Hi, we are from Group 27 and I'm going to talk about the heart valves. So why is it essential for properly working valves? This is because the valve is properly formed and flexible. And then the valve should open all the way so that the right amount of blood can pass through. Therefore, the valve will close tightly so that no blood can leak back into the chamber. Next, there are a few types of heart valves. As you can see, there are four types of valve over here, which is a pulmonary valve, aortic valve, mitral valve, and also tricuspid valve. So I'm going to talk about the valve on the left side first. Between left atrium and also left ventricle, there is a mitral valve. So this mitral valve will close off the upper left chamber, or we call it as left atrium, collecting the oxygen-rich blood coming in from the lungs. It will open to allow the blood to pass from the upper left side to the lower left side, or you can just say that from the left atrium to the left ventricle. And then between the left ventricle and also the aorta, there is an aortic valve. So this aortic valve will close off the lower left chamber that holds the oxygen-rich blood before it is pumped out to the body. It will open to allow the blood to leave the heart from the left ventricle to the aorta and on to the body. Let's move on to the right side. Okay, between the right atrium and also right ventricle, there is a tricuspid valve. So this tricuspid valve will close off the upper right chamber that holds the blood coming in from the body. It will open to allow the blood to flow from the top right chamber to the lower right chamber, or from right atrium to the right ventricle. This will prevent the backflow of blood from the ventricle to the atrium when blood is pumped out of the ventricle. And the last valve would be the pulmonary valve, which located between the right ventricle and also the pulmonary artery. This pulmonary valve will close off the lower right chamber or right ventricle and open to allow the blood to be pumped from the heart to the lungs through the pulmonary artery where it will receive the oxygen. So next, problem related to valves. So here there are three problems related to valve. The first one is stenosis, where the valve is too narrow or doesn't allow enough blood to flow through it. For example, there would be tricuspid stenosis, pulmonary valve stenosis, mitral valve stenosis, and also aortic stenosis. The second one would be the regurgitation. It is due to leaky valves, for example, tricuspid regurgitation, pulmonary valve regurgitation, mitral valve regurgitation, and the last one would be aortic regurgitation. And the last problem would be the mitral valve prolapse. This mitral valve prolapse, although it can be considered harmless, prolapse valves can sometimes start to leak. Then we will go to treatment for valves problem. So the treatment for stenosis, okay, medications sometimes can ease the symptoms or aortic valve stenosis. However, the only way to eliminate aortic valve stenosis is by surgery in order to repair or replace the valve and open up the passageway. Somehow, surgery isn't always needed right away. If tests reveal that the patient has mild to moderate aortic valve stenosis and have no symptoms, doctor will schedule checkups to carefully monitor the valve so that the surgery can be done at the appropriate time. In follow-up appointments, the doctor will review the patient's medical history and conduct a physical examination. And then the doctor may also discuss the symptoms and what to expect as the condition progresses. Besides that, doctor also may order an echocardiogram, to review or to view the patient's aortic valve and monitor the condition every 3 to 5 years if the patient have mild aortic valve stenosis, and every year if the patient have moderate aortic valve stenosis. And then, if the patient have severe aortic valve stenosis, the doctor may schedule checkups every 3 to 6 months. The doctor may order an echocardiogram every 6 to 12 months to view the heart valve and monitor the patient's condition. Okay, next we go for the treatment of mitral regurgitation. So for this treatment, for chronic mitral valve regurgitation, it will include the monitoring the heart function and symptoms. It also may include treating symptoms as they might develop. If another heart problem has caused the regurgitation, the patient will get treatment for that heart problem. If the mitral valve becomes severe, the mitral valve may need to be repaired or replaced. For treatment, acute mitral regurgitation is immediate. Medicines and urgent surgery are usually needed. So the last one would be the treatment for mitral valve prolapse. Mitral valve prolapse causes no problems for most people actually. Therefore, treatment is usually not needed. So people who develop severe mitral regurgitation due to mitral valve prolapse often can benefit from surgery to repair or replace the leaky valve. For people with symptoms of congestive heart failure caused by the mitral valve prolapse with mitral regurgitation, surgery is usually the best treatment. However, if no mitral regurgitation is present on echocardiogram, symptoms of mitral valve prolapse rarely pose any risk. So the best treatment for each person may vary but can include the exercise, pain relievers, relaxation and stress reduction techniques, avoidance of caffeine and other stimulants, beta blockers, which are medication to slow the heart rate, might be helpful in people who have episodes of palpitation with a rapid heartbeat known as tachycardia with mitral valve prolapse. However, most people with mitral valve prolapse never experience health problems related to the condition. Most people with mitral valve prolapse should see a cardiologist every 2 to 3 years. They do not need regular echocardiograms. People with mitral valve prolapse and moderate or severe mitral regurgitation should see a doctor and undergo echocardiography every 6 to 12 months. Echocardiography and a doctor's visit are also recommended if the person develops new symptoms or if the symptoms change.